Well, we are back with Dr. Piskin today, a dentist in Floral Park, New York. Hi, Dr. Piskin.
Good morning. How are you today?
Very, very good. We had a good Easter weekend here. What about you guys? You guys celebrate Easter pretty heavy in New York, as far as I know, when I lived there.
Oh, yeah. We had a beautiful day. Thank goodness for that. Beautiful sunny day.
Good. Now, Dr. Piskin, why don't we talk a little bit about holistic dentistry and what does that really mean? I do think that most of us have all kinds of definitions for what that means. Why don't you shed some light on it, what it means, and also are you doing holistic dentistry?
Well, holistic dentistry is a very broad term. It's like saying you're dyslexic. There's so many things attached to it. But I think anything related to dentistry and how it affects the rest of the body and the materials that we use and how diseases are recognized in the mouth and all that together, you will then create an environment called holistic dentistry. But everybody always says silver fillings, holistic dentistry, mercury, holistic dentistry. But there's a lot more to it. But I think everybody likes to think that what's going in their mouth is healthy for them, or what has been used in the past, is it still safe for them, and how does the American Dental Association relate to that? So that's pretty much holistic dentistry.
So it looks to me, you gave me two kind of two sides, two definitions literally of holistic dentistry. One is, kind of like holistic medicine, where maybe you take some holistic pills, drops, or whatever, which for all purpose are they're including the virus of which you eat, which they try to avoid you eating it, and by doing so you prepare the body. So in medicine, to a degree, that's called holistic, and it seems to be you have some of that going on, like with silver filling. Use non-chemical to cure the thing, but then you have holistic, and correct me if I get this all wrong with this definition what you gave me, as how it relates to the whole body. Like, for instance, how does a out-aligned jaw, which comes maybe from missing teeth, maybe from a car accident, maybe from teeth crooked crown in the first place, how does that relate to maybe headaches, muscle pains, back pain, and all kinds of things? How does gum disease relate to kidney failure and perhaps premature born babies? That type of holistic in a sense of like the whole body. Did I get that right?
That's a good one. Well, there's so many things that we see in the mouth that we can relate to other things in the body. So as a dentist, we want to recognize some of those things. What does the tongue look like? What do the cheeks look like? How do the teeth work? Are people chewing correctly? Are they nutritionally doing well? Are they eating well? How can that affect the mouth? So nutrition becomes a big part of it. Also, the idea of silver fillings. We've always had silver fillings in dentistry. I have not done silver fillings in over 23 years. We have better choices today. Composites, ceramics, bondage restorations, being able to do things in a very small amount, which is called minimally invasive dentistry, where we save tooth structure instead of drilling tooth structure away. So there are a lot of things that today we can do to make the mouth healthier without destroying good part of it, and also watching to make sure that the diseases that affect the rest of the body aren't recognized in the mouth. So it's a combination of nutrition, using newer materials, eliminating some materials that maybe could have been not so helpful or harmful to the body. And they feel sometimes silver fillings might have a little bit of that. But so there are a lot of things with holistic dentistry that goes along with how we approach our patients today, not just looking at a tooth and saying it has a cavity and fill it. We are much more medicine inclined today.
Right. You mentioned a few things. You can see certain things from the tongue, and as the gum disease affects things and how it affects the rest of the body. For instance, many of you dentists, you do, let's just say, snoring appliances, so a person sleeps better, has more oxygen, and that type of stuff. If you look at the head, it looks like that whoever made it, let's call it God. He has put a lots of important stuff in there. So the point is, it becomes more and more obvious that the mouth and the teeth have a much greater overall synergistic influence on the body than was previously known or assumed.
Well, the medical community now recognizes that a lot of the diseases that they find associated with heart disease, especially, and coronary artery disease and plaque, a lot of the problems and the bacteria is all related to inflammatory response, the inflammation. And it all starts many times in the mouth. And gum disease and periodontal disease is one of those things that we see causing the inflammatories, the rate to start and end up with higher incidence of heart attacks. They've related it to premature births, and other medical conditions, but we are now using dentistry as our first stepping tool to recognize things that the medical community really didn't realize at first.
Right, like for instance, in the last literally only a couple some more years, very, very heavy, almost every surgeon, regardless whether he takes out appendix or does a hip operation, he will want a clean bill of oral health. He will say, go to the dentist and see to make sure you have no gum disease. Because if you do have gum disease, my operation, as simple as appendix or a tonsil operation or a meniscus, might become dangerous because it's toxing the body. So one more cutting in, which is not a good thing for the body. If the body is weakened because of gum disease, is simply not a good thing. And not dentists, surgeons recognize that more and more. Is that true?
That's true. They always ask medical clearance, dental clearance for especially prosthetic replacements. Someone's going to be getting a new heart valve, open heart surgery, vascular surgery, hip replacements, knee replacements. They do ask for dental clearance to make sure they're disease-free, because you can go ahead and have this medical condition, and if you don't look at the whole body, mouth first, things happening in the mouth can spread and cause infections in other parts of the body, especially in a new area like a new hip or a knee, and cause another infection to incur and subsequent problems with that.
Right.
So,
well, Dr. Piskin, thanks a lot for explaining holistic dentistry. I think that sheds some light on a lots of us of kind of like wondering what does it really mean. And it's good to know that dentistry is going in that direction to include the whole body. Thank you very much.
You're welcome.